This video series was developed by veterinarians at Cornell University College of Veterinary Medicine and the United States Department of Agriculture. The majority of diseases of poultry produce a wide range of overlapping clinical signs and gross lesions. In order to make a definitive diagnosis, in most cases you will need to work with your diagnostic laboratory to identify the causative agents. During the ante- and post-mortem examinations, a variety of diagnostic samples can be collected, such as blood, swabs, and tissue samples. In the laboratory, these samples are commonly tested for antibody titers and for the presence of specific viral, bacterial, or parasitic agents. When collecting diagnostic samples, keep in mind that the accuracy of test results is dependent upon the quality of samples you submit to the laboratory. This video series will demonstrate the proper methods for collecting a variety of different types of diagnostic samples in poultry. In the ideal situation, a standard baseline of diagnostic samples should be submitted for all poultry cases. This will ensure that the diagnostic laboratory receives all the samples required to conduct proper testing. The suggested set of baseline diagnostic samples in poultry may include blood serum samples for serological testing, oropharyngeal or cloacal swabs for virus detection and bacterial culture, tracheal swabs taken during the post-mortem exam for virus and mycoplasma identification, swab samples taken from the air sacs, liver, spleen, and lung for virus isolation and bacterial culture, a set of fresh tissue samples for virus isolation including the comb, skin, brain, trachea, liver, spleen, lungs, kidneys, bursa of Fabricius, and cecal tonsils. A second set of tissue samples should also be collected and fixed in 10% formalin for histopathology. These may include comb, skin, brain, trachea, liver, spleen, lungs, kidneys, bursa of Fabricius, cecal tonsils, intestine, muscle, eyes, and bones. In addition to these baseline samples, additional sampling may also be indicated. You should submit tissue samples for histopathology from any tissue or organ that has gross lesions identified during the necropsy examination. You can submit ectoparasites and feathers for ectoparasite identification. Swab samples can be collected from the infraorbital sinuses, joints, and bone marrow for bacterial culture. A wet mount of intestinal scrapings can be made to aid in intestinal parasite identification. And lastly, you should collect any specific samples that will be necessary to help rule in or rule out the differential diagnoses.